My name is Katie McCoog. I am the clinical director at a residential treatment facility for Embark Behavioral Health in Whitehaven, PA. Anxiety has always been one of the largest symptoms for any of my clients I've really worked for because it's that fear of unknowing that really brings that symptom of anxiety out. So if you think about general anxiety, you're pretty much going to experience some kind of, I call it like a spectrum, where general anxiety is like, okay, I feel a little bit here, but I'm at home, I'm in my safe space. I know it's there, but it's not really interrupting my daily functioning, me being able to do anything. To this broader spectrum over to social anxiety is more like I am in social settings. I'm incredibly uncomfortable. There's not a lot of things that are helping me feel calm or safe right now because I'm not sure who's around me. I'm not sure what's going to happen. Am I safe? Can I calm myself down? What are other people thinking of me? And general anxiety is kind of just like an always there thing where social anxiety is very, very like specific. Even thinking about going in a social setting can get somebody to start feeling more anxious and uncomfortable, and you're not even in that environment yet. Everybody is just so different and they experience it in different ways that it's unfair for me to say, hey, you need to look out for A, B, and C. What's the person's baseline look like? How are they normally? So I would say it's a marked change in their personality or their characteristics, right? So they're either starting to get quieter or they're starting to talk way more. There's things like their body could be shaking from their hands, their legs, they can breathe faster, their heart might feel like it's racing, their face might go pale, it might get really red and flushed, right? So if there's a marked change from that you can see, and it's because of a very specific situation, I would say make sure you're checking in with that person because they might be experiencing something internally. Social anxiety can be mistaken for shyness. It can present symptoms of ADHD, hyperactivity. People might get angry and irritable. Like that's why, like I want to tell you such specific to help people understand. Like, hey, it's that right there. But it really depends on the human being experiencing it. So somebody who has social anxiety might get very short, irritable, angry, explosive. They might get very, very shy, quiet, kind of just withdraw, remove themselves, or look disinterested. So they're looking at their cell phone a lot. Like there can be people that get really, really energetic because you feel almost like an adrenaline rush in your body. And so that's the thing. If there's like a real change, that anything that makes you stop and go, huh, I wonder what that's about, I would say would probably be your first indicator of that person's not feeling like themselves. So checking in with them, hey, how you feeling? You okay? Is always the first good step. We've got these internal instinctual responses in ourselves that is fight, flight, freeze, or fawn, which is people pleasing, fawning. And if somebody feels that trigger inside of them, their brain automatically goes, we're not safe, we need to, and then fill in the blank. Why are people sweating? Well, that's their body actually saying, well, the brain's saying we're in trouble. So now the body's going to try and start regulating, but not really knowing where the message is coming from or what that message is. It's such a clutter in their head. It's like 5 o'clock on a Friday afternoon and you're trying to go and get something to eat. That road is so clustered with so many different people trying to get different ways. That's basically what our emotions and our neurons are doing in our brain, is they're firing off, but nobody knows where it's actually coming from. So the body tries to respond as a self-preservation tactic. Again, so many different people in so many different ways. You can have high blood pressure. We call these like psychosomatic symptoms. So it's your body is holding all of your anxiety that you're feeling. So you could have muscle tension, soreness, headaches, profuse sweating, high blood pressure, low blood pressure. You could have arthritis from it. I mean, your body really holds that because it's the chemicals in your brain are becoming unbalanced again and shooting off like these different messages to your body. So physically you can, and that's usually why a lot of people are like, okay, taking a deep breath. Well, did you know taking a deep breath brings more oxygen into your blood? Your blood takes that oxygen, puts it throughout your body, that calms those sensors down, saying you're not actually in trouble physically. You're okay. You're safe because you're getting all of that oxygen into your body. That's usually how panic attacks start, right? Your brain convinces your lungs that you're not getting enough air, but you are getting enough air. So taking those really deep, intentional breaths is taking that oxygen into your brain through the bloodstream and then back out to your body. And that's how your body actually starts to calm down, which makes your heart feel better. And then you start to relax. Knowing your triggers and knowing like what's the environment you're about to go into. Do you know that it triggers you? Do you know you're going to have a hard time? What are some comfort items that you can carry in your pocket? Like I go sensory, so textures and feeling things. So cold water helps with your system to calm you down. Some people have like one of those worry stones where you just rub it and it stimulates the nerve endings in your fingers that actually stimulates your nerve system to calm it down. Your fingernails are really soft, so you can rub your fingernails. So there's a bunch of different things that I can actually go through with you of like how you could just use like your own, like the pants that you're wearing. But the important thing is really knowing what your trigger is or what you think. If you're anticipating like, hey, this might be a stressful situation. I think I'm going to wear my favorite pair of socks today. I don't know. Or your favorite hoodie like I am today. Knowing that I've got my comfort item on me, I'm going to be like, yeah, but I'm good in this. This brings me comfort. I know I'm safe. It's nice and warm. And just knowing when you're going into that situation, just being prepared for it. Therapy gives you just this really fantastic space to I love telling our parents this because I work with teenagers and I tell our parents, this is the one place where you get to go and just say everything that you need to be about you and you don't have to stop and think, oh, what's the social cue? So how are you doing? And I was like, no, you get this is your hour all about you. Just unload everything you possibly can. Don't worry, there's no judgment. This is incredibly safe space. All we're doing is trying to hold that stuff for you so you can sift through it so it makes more sense. So therapy is the most selfish and selfless act, I think, a person can do. And there's a lot of negative stigma around it right now, but honestly, it doesn't even have to be like for those who are like put off by therapy, like you talk to your boss, don't you? You talk to your friends and family, don't you? But there's a personal connection when you have a therapist that is literally dedicated to you to go, I'm good. So let's talk about you for the next hour. Just let me have it. There's something so cathartic about it and freeing that you don't have to worry about how am I going to be seen in these other environments. It doesn't matter. Your therapist isn't allowed to say anything. I think it's really important that people find what really works for them, but I'm happy to share that there are like a couple that I start people on. So there's box breathing. Basically, what you do is you draw a box in the air with your finger, but you inhale when you go across, exhale when you go down, inhale, and exhale again, but you're just drawing a box. It's just to help trigger that like message to your lungs of like muscle memory. You got this. It's okay. Your brain is taking control of the situation instead of your body having a physical response. People are ready for help whenever they're ready for help, right? Like, I don't want anybody to think that the minute you ask that question of like, should I go see somebody? Yeah, sure. Go for it. I mean, when is the right time is the moment it pops into your head because everybody's different. You don't have to hit a certain level of anxiety of like, okay, I've had 5 panic attacks in the last week. I should go and see a therapist. No, you know what? Sometimes you just need that space where you just need to talk to somebody. Therapists have therapy. I have a therapist, right? And sometimes it's a check-in just to be like, so my week was kind of, being a Monday all week. let's just talk about it for a minute so I can ground myself and get back to work. But there is no right or wrong time. I think I don't want people to sit there and wait and think it's not that bad. It's not that bad, because that's how it gets bad. So don't invalidate yourself. If it pops into your head that you think you might need to talk to somebody, that's exactly when you should go and talk to somebody. If you're seeing an issue that you think is concerning, I think it's a great idea to first go to your student, I'm going to call them, and ask them about it. It's their body, it's their life, even if they're like, no, I'm fine, but like they're clearly not fine. First, just having a conversation with them to let them know like your input in all of this is incredibly important. It's essential because it's your life, your body, and I just care about you. If they've got a trusted adult at, if they go to school or they're in clubs or sports or a best friend's mom or dad or whoever, right? Like it's a community, right? Like that old adage of like, it takes a village to raise a kid. Like it's true. So if they don't feel comfortable talking to you, that's okay. It's because you're their guardian. Like it's okay, but they're probably talking to somebody. So making sure that we've got this very shared space of like, we just care about you, and letting your kid tell you like, all right, I'm okay with talking to this person about it, but I'm not doing this. So making sure that they're involved. There are going to be times where you have to pull that card of like, yeah, well, it's my job to love and protect you. And part of that protection is that I have to make a decision that you're not going to like, but I want you to know I'm making that decision. I had some parents in the past who came to Whitehaven would said it was the easiest hard decision I ever had to make was to put my kid in residential, because I knew that they weren't safe. It was hard because I didn't want to. I knew they didn't want to, but I also knew it was the only thing that was going to help them. So it was the easiest hard decision. And I was like, I really love that, because it's incredibly difficult. But at the end of the day, it's all about making sure that your child's okay and that you guys have a long life together. First, for our guardians out there, calling the card on the back of your insurance card and saying, hey, who are my providers in the area? They'll give you an entire list that are in network with your insurance, that's very, very helpful. That doesn't mean that those are going to be the right people for you, but certainly it's a good place to start. You can go to your primary care physician and say, hey, I'm having these symptoms, or I'm concerned that little Jake is having these symptoms. So what do we do about this? They can help set you up. There are social workers and counselors in schools and communities, doctors' offices. If you have state insurance, they have a whole department that are just case managers to help. I'm not biased or anything, but Embark is super good at helping people. I just want to say. And you know what? Honestly, I can say confidently, like Embark is a place that if we're not the right place for you, that's absolutely okay. But we're certainly going to help you get on that path to find the right place too. Because again, it's about your life and your family. And we really that's our mission, is to help. You matter. Period. You matter. Your feelings are not wrong. There are other people that suffer from similar symptoms. It's not to say they know your story, but you matter. Your feelings are validated, and you're important enough that you deserve to feel better, whatever better looks like to you. You are accepted and loved as the human being that you are. And if you need a little bit of help, like, we're here to help.